So the Senate is an actual gridlock. And if I know anything about Trump and his negotiating skills, is that he wants to be the winner. And I've read all of his books. And The Art of the Deal is one of the biggest books that kind of has a kind of gets into his head and how he negotiates. And and I've done a lot of negotiations in my time, and there always has to be winners and losers, and for Trump, he has to be a winner. So, I really think that he's gonna go literally balls to the wall in this one, and they're gonna be in gridlock for a long time, and I also see on the other side, like, Schumer, he's already kind of bowed down to them back in March and had really repercussions from his party, and I really think that he's, like, standing strong now in these final negotiations. So this is the first time that they have shut down in almost 7 years. So it's entered second day now, and there is real some impasses over funding to bill and will the government ever reopen? Well, obviously it will at some point, but they're also having some gridlocks on the continued resolutions, the CRs. So I was watching. I hardly watch the news at all anymore, and they because it just seems like it's just a echo chamber for whatever side you're on. So last night I was listening to Fox, and the echo chamber was just nonstop, how it's all the Democrats fault. The day before I was listening to like CNN, and it's just all the Republicans fault. So I really have based kind of all my thoughts are based on just doing my own research on the internet. It's like it's the only way you can kind of find some real information, because like I said, these news stations, it's just a propaganda for whatever side you're on, and I'm so sick of the echo chambers. I wanna really know what's going on. It seems like in my house, all there is Fox plays nonstop, so you just keep hearing the same shit over and over and over again, and so that's why I've really depended on independent creators and listening to all sides of the story to really come up with what's really going on. But like I said, I've listened to Trump, obviously everybody has for years now, but even way before that, when he was writing those books, about business, I was reading a lot of his business books, because in my business, negotiations are a huge part of my business, and it really is hard, because it's almost like in a negotiation, like both sides need to win, and so it's trying finding that balance, and do they ever come to this balance? But one of the big things here is that he's going to shut down the New York Transit. So they have this tunnel going through it, and they're supposed to be spending $18 billion on this tunnel in New York City, and then expanding some of the subway lines. So that is going to come to a complete halt. And it's almost like they have to start taking shit away to get them to start to bend. And that's one of the big things that Trump is kind of narrowed in on, is this New York subway transit funding. Like I said, $18 billion is at an absolute halt right now. And then you have the federal courts. They're only going to remain open till October 17th, and then there's going to be a complete shutdown. So, like I said in my last video, there's going to be so many kind of government federal businesses and services that are just going to be shut down, like the SBA, national parks. All these things are going to cost. They estimate that if this keeps going like it did in the last time, like 7 years ago when it happened, and it lasted for 35 days, that said it cost the government or the country $414 million. So this is going to be nonstop. It's not right now. If nothing happens, everybody's losing. Like I said, I think Trump is holding out, and it's almost like playing chicken. Who's gonna jump off the road first? And I just don't think it's gonna be Trump. So, and I think the Dems are gonna hold on like no tomorrow. Then this they're want to cut billions and billions of dollars, which I find very interesting, because the progressives are just like, we need to cut, cut, cut. Yet the big beautiful bill has added $3 trillion to the debt. So, but one of the things that I was really focused, like as I was listening to the echo chambers last night on Fox, I was listening to Fox last night, and this has been a continuous thing, is the healthcare. And this is what drives me crazy about listening to news stations. It's because it's like you get their side of the story and you really don't get the truth. And it just never made sense to me, because they keep saying we don't want to give health care to illegals, and then you listen to the other side, and I don't think it's that they wanna give healthcare to illegals, and, like, so I did my research and I looked this up, and it said that the federal laws, um, they ban they're barred against undocumented workers, immigrants from, the Obama Affordable Care Act plans and regular Medicaid. They cannot buy subsidized Obamacare plans and don't get full Medicaid, period. Hospitals must stabilize anyone in emergency under EMTALA, regardless of status. That's not free comprehensive health care. It's emergency stabilization only. And a few states use state dollars, not federal, to cover some undocumented residents, their choice, their budgets. So, example, California expanded Medi-Cal to all income eligible adults, regardless of status, and claims that current shutdown fight is about free care for illegal immigrants are false. Democrats are pushing to extend the ACA subsidies for citizens, lawful present folks, not to fund federal benefits for undocumented people. So that's all fair and well, and I understand that. But what I think that is kind of coming underneath the radar and where the progressives are somewhat right and correct in this is that so if you go to the emergency room and like this happened to me a year ago. I had to go to the emergency and it was a doctor kind of was sending me there because I needed something that can only be done in emergency. So my doctor sent me to a specific hospital. So when I walked into that hospital, into the emergency, I was like literally the only white person in the whole emergency room. And I'm looking around, I'm like, "Oh my god, I like it wasn't in the best area of town." And I'm just like, "I know how much I spend on healthcare. How are they affording it?" And this like I could not find a seat. I literally had to stand and wait. And I just couldn't believe it. So I was like, "Well, God, where do all these people are they all these people paying for the I like I said, healthcare is expensive. So how are they affording all this?" Because it just seemed like, um, yeah, it wasn't even people I see in my normal everyday life. It just seemed like I don't like I said, it was a specific hospital in a specific area of a not so nice area of town. And I just couldn't believe it. And again, all in emergency. And I just don't understand where does that money come from? Because if they're for emergency services, they treat them no matter what. And another example of this is when my son got into an accident around Christmas time, and he was in a gyrocopter, which is literally a go-kart with a propeller. He was rebuilding it with our 75-year-old neighbor who was in the helicopter business. Anyways, he goes up, and my neighbor couldn't see him, but he fell probably 3 stories out of the sky, fell. Luckily, someone on the he's in, like, in the middle of the desert in Arizona, literally in the middle of fucking nowhere in the desert. Luckily, there was a highway that goes through, and there's these power lines, and one of the reasons that he went down is 'cause he should have accelerated and kinda avoided the power lines, but yet he was headed straight for the power lines, and I guess he panicked, took his arm off the throttle. He goes down. Some people on the highway actually saw it, called 911, and they ended up, sending a helicopter. So they sent a helicopter, they get him, I get a call, he's in the hospital, and all this time, there's no one stopping to say, "Hey, where's your insurance card?" Because it's an emergency. And and actually at that time, he wasn't under my insurance, and I wasn't sure he was under his dad's insurance, and I was like, "Holy shit, this is gonna cost a fortune." So in the meantime, we're like, just, "Is he okay?" He had some broken bones and he was fine, thank God. But anyways, in the meantime, we're like, when kind of "Oh, he's okay, it was fine." Holy shit, whose insurance is he under? Because he wasn't under mine, and I'm, like, talking to his dad, like, "He's under your insurance." Because we started to look at the bill. By the time we started to think about the money part of it, the helicopter ride was $55,000. $55,000, and when I was in emergency that time, my bill was over $10,000. So it's expensive, and so and when he went to the hospital, the helicopter ride was $55,000. When he got there, and they had to send him to a specific hospital again because it was a trauma center. So once he got into the trauma center, he was there, and when he was in trauma, he was there and they couldn't get us. We couldn't go in to see him because they were so backed up. There were so many people in trauma at this hospital, like, they couldn't get to us, and he was literally sitting there with dirt all over his face. They had him in a neck cast, but couldn't move, and he had no doctors because they were so busy. She's like, "We are so busy, we're so understaffed," and, that's how busy it was. So, like I said, by the time we actually thought about the money, that the helicopter ride, plus he had to stay there a night in the hospital, plus he had a surgery on his arms. So he was probably well north of $100,000 at the end of the day. And so people say, "Oh yeah, we're not paying for undocumented workers," but no one asked when the helicopter comes to pick up someone who's injured. They don't ask, "Do you have your insurance card on you?" It's they just deal with the emergency, and then so that I think that's what people don't understand. That's that money there, if he wasn't insured, well, for us, because we are here and he's an American citizen, they would come after you for the money and say, "Well, you're not insured, so you still owe us the money. Now you have to pay cash." And the number one causes of bankruptcy in the United States is, medical bills. So if he didn't have insurance, that would've and he's an American citizen, it would've went under, him, and he's young, it would've ruined his life or would him at our pockets, $100,000. Like, that's a lot of money. So, when these undocumented people are here and there's an emergency, shit hits the fan, they go to the hospital, they're treated. Well, they don't there's no documentation. I don't some of them don't even have Social Security numbers, so they don't know, they're just treated because it's like, it's inhumane not to treat them, so they're treated, but then if they're undocumented, they could just go back to where they were for before, they could give them false names, false Social Security numbers, and where is that money? There that what people don't understand is that money has to come from somewhere. So if they're undocumented, they're illegal, immigrants, they're here in the country, they have to go use these services. It does cost money. So when the Democrats are saying, well, it's only for like comprehensive, and yes, they can't go see a doctor, and it's not going to cover if they've got a sickness, they have to go. And yes, that is not covered. I had to go through cancer treatments. I go to the Cancer Institute. Before they even look at you, they sit you down in a nice little calm office with like dim lights and this white noise going on. And I've never experienced anything like it. I'm looking at them like, oh my God, what's going on? But they sit down with you and they go through your insurance and say, you're not going to see a doctor until we make sure that you're covered, you have insurance, this is how much you owe, this is how much it's going to cost, and then yes, that's not covered. However, those emergency situations are covered. Just my son, one example, is well over $100,000 that would have cost, but where does that money come from? And if he was an American citizen, who eats those costs? And I believe if we're eating the cost, if the people that are here, citizens, permanent residents, we're here paying taxes and putting money into the system, and we're paying for healthcare, that is gonna cost us more because 'cause we're gonna have to subsidize those costs, and I think that's where they're getting at, and that's where the big messages come breaking down. Um, the GOP saying, "Yes, we don't wanna pay for undocumented workers," but they're like, "No, we're not talking about an undocumented worker or, illegals." But it's almost like one and the same. They're missing the point. They keep dodging the point that if they're here illegally, they go to an emergency, someone's paying for it, and it's gonna be us. So, again, that was just been kind of their main point of contention, and it's almost like no one's getting down to the point, they all scoot around it. You go on Hannity and you're like, "No, they want illegals have healthcare." Well, that's not true, they're not gonna have healthcare. However, when you go on the CNN and they go, "Oh, no, we're not gonna give healthcare to illegals," but yet, if the illegals are here, they're in emergency situations, someone's gonna pay for it. Yes, they can't go to the Cancer Institute and have cancer, that we all understand. However, there's like I said, I walked into this emergency room here in Phoenix, I couldn't find a seat. I had to stand and wait my turn because the seats were that full, and I was literally the only probably Caucasian person there. So to say that that's not a problem, I think is false. And then we go back to, again, the progressives, it's borders first. So they want no federal benefits for undocumented, and they wanna keep the Affordable Care Act Medicaid off limits to people who are here unlawfully. Again, that's true, but they're not really have access to it. And then market-based reforms, price transparency, competition, HSAs, short-term plans, fewer mandates. They obviously, and then Democrats going, "Well, it's gonna hurt the seniors," but I don't think the seniors are gonna be touched in this situation. Again, they're gonna protect seniors programs, but contain cost. And the 2024 platform messaging shifted away from explicit Medicare cost. And then the cost focus, oppose making pandemic era ACA subsidies permanent are too expensive. And then again, we go down to the emergency Medicaid cost. That's, to me, that is what's straining the country right there. It's just these emergency costs with all these illegals here. You're talking about 10 million plus people that came across the border in the last 4 years. Think about 10% using the emergency systems here in the United States. It's going to cost somebody. And again, on the Democrat side, they want to defend, expand the ACA, keep enhanced subsidies so legally eligible Americans don't lose coverage, finish Medicaid expansion, and lower drug costs, which I think that they're starting to do with Pfizer. And I actually do agree that they have to keep some kind of a subsidy. And even essentially with the Affordable Care Act is taking there it is subsidies, but instead of getting tax returns, you get the money on, say, if you, instead of getting $8,000 back in your tax return, if you do the Affordable Care Act, they subsidize you. And so instead of your money coming out of your pocket, it comes out of your tax returns. So essentially, if I have $4,000 worth of medical premiums throughout the year, I use that subsidy, and so I only get $4,000 back on my tax return, and then that other 4,000 was paying for subsidizing my healthcare costs. So it's less out of pocket, which to me is a very smart idea. I think it was great. I think that we're a first world country. They should have some kind of healthcare. I come from a country with subsidized healthcare. That's a whole other subject. But there has to be some kind of system where people living in a first world country should not have to die because they can't afford healthcare. When I was at the Cancer Institute, when I asked her, I said, "What happens with people that?" Luckily, I have very good insurance. I was already in my deductible. I had over $1 million worth of medical bills one year, so luckily I hit my deductible, and then everything was taken care of. But I said, "What happens to people that don't have medical insurance, or it doesn't cover this?" She's like, essentially they're just shit out of luck. There is no recourse, which I think is not right either. I don't think anybody should die because of medical, like, and all this money that's going into the medical system is from these emergency rooms and paying all this money for people that aren't here illegally. And then you have people on the other side that, they can't afford full health care and they're dying. I had a client that was a hand and wrist guy, finger, hand, and wrist, and he would have accidents, and sometimes their insurance coverage would only cover, say they got all their fingers cut off, the insurance would only cover like 2 or something. And he said so many times that he just couldn't do it. So he would go and finish the job or do things, and a lot of times 100% of it wasn't covered under insurance. They would only cover so much. So I do think there is a problem with the medical insurance, but the way they're positioning it um, is just not correct. And what they have to understand, the Democrats have to understand, these illegals coming in using the healthcare system that is offered to them through these emergency systems because they have to, is costing the country like millions and millions of dollars. It just is. So anyways, I think it's going to be very detrimental if the government just doesn't come to some kind of a head. Um, they have another vote on Friday. We'll see if and that's just to have continuing resolutions, which is CRs, and they're even like going head to head at that. So they're discussing, other, hey, can we just they want to essentially should keep the status quo going and give it another month, keep it going, but they're going against that as well. So they don't want to extend what's currently going on now. Essentially, they want the the chips to fall and see where they land and kind of put pressure on each other's side to see who's going to fold first. And I really don't think it's going to be Trump. Like I said, what I've noticed from his negotiating is when he plays chicken, he's like all in. He's balls to the wall, and it will be very interesting to see what the Democrats do. I think they got a lot of pressure on their side as well. Um, so we'll see what happens. But at the end of the day, it's going to be the government workers that are going to be hit at the end. A lot of the government workers, the contractors, they're going to be furloughed, and that's part of Trump's plan is if they get laid off, then it will just become permanent. And that's one of his ways to cut. And I think Democrats are really trying to save those workers. You have the TSA workers. They're going to start not getting paid. And at some point, it's hard to keep working at a job where that's what I just don't think people understand. Well, I'm sure a lot of people understand, but a lot of people are working paycheck to paycheck. So when they don't have their paycheck coming in, it's hard for them to get to work. How do they pay for their kids? How do they pay for the roof of their head? And a lot of times they say back in 2018-19, they created this law. It said, well, all that back pay will be paid back to them. But if this goes on for 35 days, like it did last time, who's going to pay their rent for the month of October? Then that brings you into November, and it's still at a standstill. Who's going to pay the rent? It's not even during COVID. You saw that a lot of people, their rent was still due, and it was very difficult. So it's going to be really, really difficult for a lot of federal workers. Like the SBA loans, that's all been at a halt. So it will be very interesting to see what happens hopefully tomorrow there's some kind of resolution. But like I said, I have to go back and I can't. I tried to listen to Fox last night, and even when you get from Jesse Waters to Hannity, then you got like it's all essentially you just have to listen to one of the shows because then you get the whole gist of what's going on. It's just a continuation. It's not like you get anybody else's point of view. I know they have the five, and again, you have the one person that's trying to argue back and forth, but you really have to do your research to find out what's really going on. And this healthcare thing, I think, has been really pushed out there. And to understand it is the way I see it. The illegals are costing the country millions and millions and millions of dollars, and it is plugging up the system, but they're not creating comprehensive healthcare. And that's what they need. So essentially, if they're not going to have it, they're eventually going to need it, and it's just going to drain the system even more. And I think that those illegals coming in that want to then get on the affordable health care and then start this process, it's gonna be timely, and it's not going to happen overnight. So we'll see what happens. So let me know what you think. Please like, subscribe, share, and I'll talk to you guys soon. Bye.